Good day and welcome to the Nutrition Know-How in the New Year, a Lunch and Learn for Patients and Caregivers conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Jennifer Gillette. Please go ahead.
Thank you, Sandy. Yes, my name is Jennifer Gillette, and I'm the staff social worker at the National Bone Marrow Transplant LINK. I'd like to welcome everyone on our Lunch and Learn with the LINK call today. This month's speaker will discuss the importance of nutrition on survivor wellness. It's our goal that today's program will inspire you and equip you with a new skill or idea as you learn how to go through this journey. A special thank you to the Leukemia and Lymphoma Society for making this program possible today. We also thank our LINK partners for keeping all of our support available to those who need it most. Just so everyone knows a general outline of how our program is going to go today, we're going to have a brief introduction. About a quarter of the hour, we are going to have our first speaker, who's a registered dietitian. The second quarter of the hour is going to be a survivor who is a peer mentor here at the LINK. And then we are going to open the remainder of the hours for questions, and then wrap up is going to be a few minutes at the end. For those who may not be familiar with the LINK, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. Some of the resources we provide to help families navigate the transplant journey are our chronic graft versus host disease telephone series and webinar support, our caregiver webinar series. We have a peer support mentor program for patients, caregivers, and donors, our second birthdays recognition program, and we also have multiple books and provide referrals and emotional support from a licensed social worker. We provide a variety of other educational and support opportunities, such as the call you are on today. Please feel free to reach out to us if you're interested in any of our services. Before we begin today's program, I would like to take a few moments to discuss some housekeeping items to maximize the experience of those on the call today. Due to a limited amount of time and with a desire for everyone to have the opportunity to participate, the facilitator will need to make sure each question or comment does not go longer than necessary. We also ask that you please only ask one question at a time and go back in line to ask follow-up questions, just so we are able to answer as many as possible from different callers. Please also refrain from any judgmental statements towards fellow participants, respecting that everyone handles this journey in their own unique way. And lastly, please know that the information provided in today's program is meant to stimulate conversation with your own healthcare provider and is not meant to replace your individualized medical plan. Now on to our program. Our first speaker today is registered dietitian Ann Younker from Hackensack Meridian Health Theurer Cancer Center. Heather primarily works for the stem cell transplantation and cellular therapy program, overseeing adult stem cell transplant patients in the outpatient setting, along with other oncology patients in the areas of leukemia, lymphoma, myelodysplastic syndrome, and multiple myeloma. Ms. Younker provides nutrition assessment, counseling, and education to patients pre, during, and post-treatment. She also teaches a weekly nutrition class with an emphasis on food safety, specifically to the transplant patients and their caregivers. Ms. Younker has lectured at symposiums on various oncology and nutrition-related topics. She received her Bachelor's of Science in Food and Nutrition from Montclair State University and is credentialed through the National Academy of Nutrition and Dietetics. Thank you so much for joining us today, Heather.
Thank you very much for having me. Good afternoon, everyone. So I'm so happy to be here to talk about my favorite topic, nutrition. I've been working with a stem cell transplant for a number of years now, and I work in a very large institution where we do about 400 transplants per year, or maybe a little bit over. I didn't see the numbers yet for 2018. So I come across a variety of patients in all different aspects of their treatment and recovery. And I recognize that today I'm speaking to a number of patients who are in different points in your treatment and in your recovery. So I may primarily I'm going to focus the talk on survivorship and post-transplant issues that may occur. So as you may know, it can be many, and it can run deep. So I may not touch on every single thing, but please do ask me if you have any questions during the question and answer period, because it's difficult because of time constraints to kind of touch on every single thing in reference to nutrition. So my key talk is really dealing with nutrients and healing and maintaining your balance post-transplant. After stem cell transplant, we know that the body's nutritional requirements can be changed. Your food intake does differ depending on issues that you're dealing with at the time, maybe comorbidities such as diabetes or kidney disease or GI issues, graft versus host disease, which alters the entire GI tract, mouth sores, altered taste, decreased appetite, which can lead to decreased intake, decreased weight, so it sometimes becomes a vicious cycle. It's very important that we know that you try to eat proper nutrients and calories to help with the recovery and to get back to your healthy goal, your healthy self. Easier said than done, I know. And the main goal is to minimize your risk of any reoccurrence and increase your survival. So all that sounds nice and easy, but it can become a battle for some. As most of you know, as I mentioned before, nutrition is very in-depth, very vast, and there's so much to discuss. So I have about, 15, maybe 10, maybe 20 minutes to discuss it. I want to begin by talking about food safety guidelines. I usually leave this for my last talk, but I think it's important actually that I touch on it because we see a lot of issues with it. We know that if you are pre-transplant, it may not be as significant to be concerned about it. If you're on chemotherapy and your white blood cells are low, then you're concerned about it. Right after transplant, it's a major, major concern because your white blood cells and your defense mechanisms, it's just not there. And then going forward, if you're, way past, a year after transplant, then it may not be as much of a concern. But I think I answer most often, the questions I get most often in a day will be from food safety questions. So it takes time for the immune system to develop properly. The period of your very low white blood cells or neutrophil count is considered being neutropenic, and it makes you susceptible to infections from many sources, including food. So in reference to food, we recommend, number one, first and foremost, and I just had an email from our infectious disease nurse at our hospital just re-emphasizing to all of us at this institution about the importance of washing our hands. So wash hands frequently, including kitchenware, sanitize surfaces often. It is flu season around the nation, so we really do pay close attention to washing every instance that we can. And with working in food service, patients are paying close attention to us, so we do kind of make sure that we stay on top of that. Avoid any cross-contamination by proper handling of raw foods. For instance, don't handle raw meat and touch fresh fruits and vegetables. Sanitizing your cutting boards properly. Promptly refrigerating foods to below 40 degrees Fahrenheit level. That's also very important. More important during the hot summer months, of course. Cook foods to the proper temperatures as recommended. Stick to the best before and use by food labels. Wash all fruits and vegetables before eating. Part of the class when I teach very tediously how to wash fruits and vegetables carefully. That is an extremely important thing because we're finding out more and more a lot of foodborne illnesses deriving from contaminated fruits and vegetables, as you know from watching the news and reading the newspaper and so on. Make sure when you're reheating food, it's cooked and heated properly. Heat it all the way through, especially if you're using a microwave. Currently, due to the government shutdown, many foods are not being inspected properly. So maybe you've paid attention to that, or maybe you have not heard about that. But there's a lot of inspections not being occurred. So For patients who are immunocompromised or immune systems are very low, this is extremely important. Limit your intake of high-risk foods such as sushi or unwashed fruits and vegetables, uncooked foods and meats. I will recommend that you don't, right now at least, try not to have a salad on the outside if you're immunocompromised because it's putting you at a high risk. Making sure all the meats are not rare or medium and it's at least well done to protect you. And I will answer any further questions about food safety at the end if you have any. I want to just skip over to talk about the nutrients, and I'm going to tailor my talk in a few minutes about the nutrients that could help keep the immune system normal, get it strong again. That's the important thing. So what happens when you have a bone marrow transplant or you have stem cell transplant? The immune system is greatly affected. It's greatly affected by the post-transplant medications, the heavy-duty the antibiotics, the antifungals, the antivirals, the anti-rejection meds like a Prograf, and simply by chemotherapy. So healing is extremely important that you pay attention to these nutrients. We know initially leaving the hospital, it's never an easy thing to battle, as I mentioned earlier, but eventually, I kind of stress the importance of giving yourself some time and then really focusing on these nutrients. So the nutrients we believe that really can affect and help rebuild the immune system include protein, essential fatty acids, vitamin C, vitamin B, D, E, minerals, zinc, and iron. So let me begin by talking about protein. Protein basically is the building blocks of our cells, and it helps in tissue repair. So many times with the chemotherapy and graft-versus-host disease, the tissues are damaged. The lining of the GI tract is damaged. So protein helps that to heal and get stronger again. A simple recommendation is 1 gram of protein per kilogram of your goal weight. No one needs to do the math. It's a simple math, but if you don't want to figure that out, please consult your dietitian at your facility or your physician. Foods that are high in protein, however, will include things like milk, non-fat or regular yogurt, actually, dried milk products, added to liquid soups and gravies, cheese slices, nuts, seeds, wheat germ, whey protein, of course, fish and poultry and meats are great sources of protein. And a necessary thing to have some form of a protein at each meal and each snack. If you don't want to calculate it, make sure you're having something at each meal and each snack. So nuts, cottage cheese, yogurt, almond butter, soy butter. You don't necessarily have to be a meat eater. You could be a vegetarian, a total vegan, and get sufficient amounts of protein as well. B complex. Actually, let me skip over to essential fatty acids. Essential fatty acids are important. It acts as an anti-inflammatory. These are the omega fats, omega-3s, DHA and EPA. It's an anti-inflammatory, so it helps with that whole inflammatory process and keeping you healthy. Recommendation is to ensure that you have 1,000 milligrams of DHA and 1,000 milligrams of EPA. That could be easily achieved by eating fatty fish like salmon and sardines or tuna 2 to 3 times a week, or maybe having a fish oil supplement. Now, if you're going to have a fish oil supplement, you want to make sure and discuss this with your doctor, your nurse practitioner before, to make sure that your platelets level are not running low, because it can make it lower. So if your platelets level are normal, then you can have a fish oil supplement, but discuss it with them first. So omega fats are high in fatty fish, as I mentioned, salmon, sardines, tuna, also in walnuts, pine nuts, flax seeds, olive oil, avocado, and almonds. These are very rich in omega fats, as well as shrimp and soybeans are also rich in omega fats. So you want to include something like that each day. Vitamin C is a big healer. These months it's extremely important if you live in the Northeast and in the cold weather. There's a lot of research and talk about it protecting against the flu. It's not a cure-all, but it's an antioxidant. It plays a vital role in the immune function and in wound healing. So because of issues that can occur from graft versus host disease or other issues, wound healing becomes very, very pertinent. Making sure that you are not taking mega dosing, however, of vitamin C unless it's okayed by your physician or your dietitian or your nurse practitioner. Taking it in whole foods is very important. So, as we all know, oranges, lemons, strawberries, dark green leafy vegetables, bell peppers, red and green and orange bell peppers are rich in vitamin C. It's very easy for us to access vitamin C in our culture. So try and have an array of fruits and vegetables daily, and if not, then you take a supplement. Vitamin A, I want to mention beta-carotene or the carotenoids. These have been studied a lot in reference to cell growth and keeping you healthy, fighting infections, antioxidants. So anything that's red and orange fruits and vegetables is important to have. So as this is the vitamin C foods, they also high in vitamin A. And that includes also carrots and sweet potatoes and spinach and kale and collard greens and broccoli. I get carried away with the vegetables. So it's important to make sure and have at least one or two sources of those foods each and every day. The next one will be quickly because time is going. The B vitamins, the B complex vitamins are extremely important for many different reactions in our body. Most of you who've had a stem cell transplant, especially an allogeneic from a donor, you may have been placed on a B vitamin from your physician, so B12 or folic acid, and that helps with red blood cell production. You need the supplement right after post-transplant, but you also need to eat the foods. The reason why we give you the supplement, not only for the red blood cell production, but because we know it's very difficult to eat efficiently right after you've been hospitalized. So making sure that you get lean red meats, dark meat like dark chicken meat, egg yolks, fortified cereal has B vitamins, whole grains, wheat germ. Wheat germ is an excellent source of B vitamins. Vegetables like broccoli and asparagus and dried green leafy vegetables, again, like kale and broccoli and broccoli sprouts and so on. And dried beans. Dried beans is a great way not only to get B vitamins, but to get protein as well. So red beans, pinto beans, black-eyed peas. Oh, it goes on and on. So dried beans and peas are an excellent way to get B vitamins. B vitamins are vital in protecting the immune system. Vitamin D as well, which is really a hormone. It's not necessarily a vitamin, but it's essential in keeping your bones strong. So you may not be allowed to be in the sunshine. Sun is not very hot these days. You may have been told because of your graft versus host disease that you have to be very careful not to be in the sun. But many patients, I notice, have very, very low vitamin D. It's not so odd for us to see. So these patients are often placed on a vitamin D supplement. However, you can get vitamin D in rich foods, right? So vitamin D in rich foods will be cheese and fish and egg yolks and soy milk and sardines, fatty fish. The recommendation is 600 international units a day, and the upper limit is 4,000 international units a day. I do see patients coming in with very large dosages. I'm not sure if things have changed. I have not read anything where it says things have changed. However, the upper limit is 4,000, unless you've been advised by your physician. The next vitamin I want to talk about is vitamin E. It's an antioxidant. It's also vital for strong immunity. It helps with keeping your skin and your eyes healthy. We do not recommend you taking a vitamin E supplement singularly, that you take it in whole foods such as nuts and seeds, like pumpkin seeds, egg yolks, wheat germ, and using vegetable oils. If you're taking any vitamin E supplement, you really want to disclose that to your physician because it may interact with a lot of medication, including aspirin. It acts as an anti-clotting agent, so it may cause excessive bleeding. So you definitely want to discuss that with your doctor. I'm not referring to the foods, referring to a supplement. So that includes any other supplements you're taking. You need to disclose it. Iron, I know we're running out of time here. Iron is important. I discuss it a lot in this setting. Many patients are anemic just because of the disease itself. So we do stress that you do not self-dose yourself, take an iron supplement. You get permission to do so. We test often your doctor's office, your clinic, your hospital will test your iron level, and we'll be able to identify if you are anemic or not, because very often the anemia might be because of the disease. But important, it keeps the cells healthy, it keeps the skin healthy, the nails and the hair to regrow. Of course, lean meats, raisins and figs and dried fruits. Prunes are also very rich in iron. Dark green leafy vegetables like spinach and dark green leafy vegetables, green beans, fortified breads and cereals are also rich in iron. One important thing to remember is that if you're having any kind of high iron food, that you take a vitamin C supplement with it, or you take a vitamin C food with it. So an example, you're eating, let's say, spinach, then you maybe have a half a cup of orange juice with it, just to help, or maybe some tomato slices to help absorb the iron better. Zinc. I saw a piece on zinc on the news this morning, so I was kind of happy about that. Zinc is a very important nutrient in reference to cell repair and tissue repair and wound healing and the immune function, and especially in the winter months. So it helps in fighting infections. Important where you find zinc. Zinc is found in meats, shellfish like cooked shrimp and clams and so on, sunflower seeds, walnuts, fortified breads, and cereals. The one piece a physician recommends is to take a zinc lozenge, which you can buy over the counter, especially during the winter months. That can help also in boosting the immune system. One more thing I want to mention are phytonutrients. Phytonutrients aids in the immune system and by protecting the cells against issues like that we come across every day, especially if you live in the cities, pollutants, toxins, and germs. So phytoestrogens are found in many foods. My main recommendation there is to have a wide variety of fruits and vegetables, so you can get a wide variety of phytoestrogens. But you can also add a variety of spices to your food that could amp up or increase the phytoestrogen in the food. So foods such as, and decreasing your cancer risk. So spices as cinnamon, oregano, rosemary, ginger, curries, turmeric powder, which you can buy over the counter, which is also added to many curries. So you add that to your food, and that could also help to provide a lot of phytonutrients, which is protective for you. Turmeric also, as good as it is, we do not recommend you take a turmeric supplement. Because turmeric supplements, if you are on chemotherapy right now, any sort of, most medications it can interact with. So you want to be very, very careful that you're not taking it with chemotherapy, that you're eating it from whole foods. All right, that was a mouthful. I'm very sorry, but I had to go fast. I want to mention also that, just to wrap up a little bit, I want to go over the guidelines for cancer survivors. And these guidelines are straight out of the AICR, the American Institute for Cancer Research. And they are very basic, they're very general, but they're very important. So be as lean as possible without becoming overweight. Be physically active for at least 30 minutes every day, making sure that you have the okay, the approval from your doctor, your clinic, your nurse practitioner to do some minor exercises. It could be as simple as just walking around the dining room table, but it's very, very important. Or load-bearing exercises. There's a lot of good research saying that, the more fit you are, the more muscle mass you are, the better you're able to handle a lot of these treatments and therapies. Avoid sugary drinks, limit consumption of sugars to your diet. Eat more variety of fruits and vegetables and whole grains and legumes such as beans. Limit your consumption of red meats. As I mentioned, I know meats are high in protein and B vitamins, but you definitely want to limit it. You don't want to have it every single day. You want to have it no more than 2 to 3 times a week and come up with some vegetarian choices as well. Avoid meats that are charred because charred meats release toxins, which can also increase your risk for other cancers. If you consume alcohol, limit the intake of alcohol. The recommendation is 1 drink per day for women, no more than 2 drinks for men. Limit your intake of salty foods and processed foods because there's a lot of research and a lot of links to high sodium foods and links to cancer. And do not rely on supplements to protect against cancer. Rely on whole foods. Supplements should be, that's what it should be, a supplement, an additional booster within the RDAs, by the way. So anything that's mega dosing or any combination of herbals, you really want to sit with someone and understand what you're doing. Some of them are appropriate and some not. So sitting with a professional, with a dietitian, a nurse practitioner, someone in your clinic that could really explain this to you will help to make better sense. I know I gave you a mouthful, but I hope you have lots of questions for me.
Oh, that's great, Heather. Thank you so much. That was a lot.
Thank you. I know it's a lot.
No, you know what? That's exactly what we were looking for. We definitely want to make sure people know how to best heal. And so thank you so much for doing that. And we appreciate you taking the time for educating us today. I'd like to introduce everyone to our next speaker before we start questions, David Weinstein. David Weinstein is a 57-year-old from San Rafael, California. And though his working life was in the finance world until he got sick, his new passion and life work is being a ceramicist. Before being diagnosed, he was a competitive runner, likely a practice that helped him get through the protocol that followed. David has a 21-year-old son at the university in California who races mountain bikes. Aside from as much time spent in the ceramic studio as energy will allow, he volunteers with a nonprofit in the area called the Series Project that teaches high school students how to function in a commercial kitchen, producing highly nutrition-rich organic food for people undergoing cancer treatment. This puts him face-to-face with people like himself, an activity that he finds very beneficial in a variety of ways. Exercise is a critical piece of his routine, so it sometimes takes a great deal of push for him to get started. Being as fit as possible has enormous lasting value. And thank you so much for joining us again, David.
Thank you, Jennifer. I'm going to say good morning because I'm in California where it's 9:30, and I know you guys are having your lunch breaks, but there we go. Heather said a lot that has brought up questions for me, which I'll probably intersperse into this. And I'm only going to talk for a few minutes. She covered everything that I know a little bit about. I'm going to start with the Series Project that Jennifer mentioned. And it's worth writing down and looking up. It's spelled CERES. This is a little nonprofit that started about 10 or 12 years ago in the Bay Area and near the Golden Gate Bridge where I live that has now expanded in various forms, though under different names, all over the country. And the philosophy is the same. The food is built around what Heather was saying. And not only does it help either people going through their cancer treatment, most of them leukemia or bone marrow transplant survivors, but it also reteaches eating habits. After a while, you start to like what you thought you didn't like. And those kinds of movements are springing up all over the place. So if anybody is in a place where they want to try to find that kind of thing, most of them offer free or reduced price offerings for a period of 6 months or longer if you're going through treatment. So anyway, bottom line, write down the series project, find out a little bit about it, and then if you're interested, look in your local area. One of the things I wanted to talk about, I have no idea how many of the people on the line are actually currently undergoing treatment and might be encountering the lovely experience of soft tissue sloughing. That's how I was used to describe it, where the soft tissue in your mouth or in your glottis starts to become very exposed and extremely painful and making it difficult to eat. I encountered that a couple of times during 2 different treatments. I have to say, and though this is on the topic of fat, there are walnuts in it, chunky monkey, great stuff, got me through. We were encouraged to increase our weight, so Ben & Jerry's can be your friend in that respect. My eating habits have changed dramatically now that my ability to taste again is back, and it took a while for that to happen. I'm more bent into an Asian, East Asian, Indian diet, much more flavor, lots of spice, not necessarily hot spice, but lots of flavor, a lot of turmeric, a lot of garlic, and ginger and things like that. And not only does it feel like it's waking me up and warming me up inside, but as Heather said, it's got health benefits. One of the questions I'll throw out, so Heather, write this down. I want to hear about it. I've been told that turmeric in capsule form is valuable for pain management, especially neuropathic pain management, which I've been encountering for years. And that's coming from a doctor. I don't know what you think about that, but I'm curious if you're talking to somebody who's already been through treatment. Excuse me. The other thing I'll mention is dehydrators. We don't all live in places where we can have gardens, but we do live in places where we can get really good food during the season that's organic, coming from farmers markets and things like that. But you can only eat what you can eat when it's fresh. For a very low price right now, either a local store or on Amazon, you can buy a dehydrator and turn bulk that you get from places like this into dried versions of itself, either to be rehydrated or eaten dry. That, for me, has allowed me to continue to keep the same kind of diet going year-long, regardless of what's local and what's fresh. It also ensures that it's pure. I know there aren't added sulfides and sugar in what I'm dehydrating. So it's something else we can do. Cooking in bulk, exhaustion, fatigue is still a big deal for me, and I know everybody on this phone has had some experience with it. So when I'm cooking for myself, which is, I live alone, so I'm probably doing it 50-60% of the time, I cook in batches that'll last a week, and things that can be expanded on. Sauces can be added to. They can be poured over other things than just pasta, quinoa, polenta, things like that. Things with flavor that are not necessarily made out of white flour. I'll admit that the sugar habit has been a difficult one for me to kick. I haven't kicked it completely, but what I have managed to do, and this is a little easier, is to drop the saturated fat cake habit. For me, it's simple to break a habit if I stop once or twice consecutively, and all of a sudden it's not in my purview. And that's also allowed for some weight loss. The exercise part of this, as Heather mentioned, is also critical. I've found it to be almost addictive. But as far as that connects with nutrition, when you've done a little bit of a workout, even a relatively mild one, I find that my metabolism is lit up, and it craves the things that I actually need rather than the things that I want when I'm sedentary. When I'm sedentary, I'm craving processed food. When I just worked out or my body has been moved around a lot and I've broken a sweat, I'm looking for exactly what the body wants to metabolize at that time, and it's not the processed stuff. So it's easier to change eating habits with incorporating exercise into it. And again, I'm not talking about excessive amounts of almost dangerous levels of working out. I'm at a gym 90 minutes, 4 days a week. The rest of the time I'm moving around the studio, I'm carrying heavy things, I'm outside, and that's enough. That's been sufficient. So, after Heather's talk, there's not a lot more for me to add. I'm going to be quiet now and turn it back over to Jennifer. Thank you.
Well, thank you, David. I appreciate that. And thank you for joining us today. Now I think we will open up for questions either for Heather or for David, and I will let Sandy lead us there.
If you would like to ask a question, please signal by pressing star 1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. A voice prompt on the phone line will indicate when your line is open. Please state your name before posing your question. Again, press star 1 to ask a question. We'll pause for just a moment to allow everyone an opportunity to signal for questions. We will now take our first question. Please go ahead. Your line's open.
Yes, I'm actually asking a question about survivorship. I'm about 4 months post chemo radiation treatment for non-Hodgkin's lymphoma. My question is about exercise. Can you exercise too much? Like you said, it kind of becomes an addiction because it also is a mood changer. And so as, you go through treatment and the new normal, depression is huge, anxiety is huge with all the fear of the what if. So my question is, can too much exercise be harmful for a path of lymphoma? My concern is the inflammation, that kind of thing. Is there a risk in that, or do you just listen to your body as you go through it? That's my question.
This is David. I'd like to say something about that, if I may. I'm not a doctor, but I've had experience with this, and my physician knows that I'm compulsively working out, and I think the caller is saying the same thing. Her advice to me was, and this sounds hokey, but this is what she meant: listen to your body. So her advice was, she knows I'm fatigued. She knows that I've got limits. If I overdo it on one day, I'm sleeping 14 hours the next day. That's how my system self-regulates. Also, if I'm too sore, I'm not going back. So variety as well, mixing it up. I never do the same thing on 2 consecutive days. I'm curious to know what anybody else has to say about that.
So I believe that the concept of everything in moderation, and I understand for those, I'm just personalizing this, some of my friends who are avid exercisers, running marathons and ultra marathons and so on, that there's an addictive portion to it. I have two particular clients, patients in my head, I think, of the post-transplant that do extreme running, including diving, and I know our transplant wasn't too happy. The doctor wasn't too happy about that. But to a certain degree, it helped them because that was their life before. So they did extreme exercising, they ran mega marathons, and it was very, very depressing not to do it again. And the depression got kind of tough until they were strong enough. Immune system was strong enough. Their body was, they got over the hurdle of the really terrible GVHD, and then gradually worked their way up to what was the norm for them. I think if that was not someone's norm, then you have to, talk to your physician about it in reference to it leading to any inflammatory issues. I'm not quite sure about that. That's a question for the physician when you meet them. I have not read anything like that, but I think overdoing anything, if it's not you've never worked like that before, can be an issue. Not to mention hurting yourself. So you want to make sure you're doing something at least 3-4 times a week, and not just and you're finding other things to incorporate in your daily healthy plan as meditation or yoga or walking. Yes. Did I lose you?
No, I'm here.
Oh, okay. Sorry.
That helps a lot.
Mm-hmm. That's what I would recommend. Don't stop exercising, that's for sure.
Right, thank you. Can we have our next question, please?
If you find that your question has been answered, you may remove yourself from the queue from pressing star 2. We will now take our next question. Please go ahead, your line's open.
Hi, I wondered if you had, Heather, any nutrition pamphlets or online information you could share with us.
Oh, in reference to booklets and so on? Is that what you're saying?
Yes. Uh-huh.
Are you there? I'm getting a delayed, yes. But I'll try to. So I recommend a lot to go on even the AICR. I love the AICR. They have a lot of good hands-on information, including recipes. So I use them a lot. I use information from the American Cancer Society. I use information from my fellow colleagues, dietitians. Right now, I'm starting to do refer to a blog. What's it called? The Cancer Dietitian. Believe it or not, that's what it's called. You can just Google it. The Cancer Dietitian. Not so I like that term, but that's what her name is. And she writes a blog in very, very basic general lingua, and she also does recipes, and she publishes it online. So, and she's a registered dietitian working mainly with oncology. So she's a good one. I mean, I hate to give all the business, right? But and the American Dietetic Association, or the American Academy of Nutrition, actually, the American Academy of Nutrition and Dietetics. That's the organization that oversees all the dietitians in the nation. And so they publish a lot of nutrition information for the public, and also on oncology, and even, some research articles and so on. There are probably a ton more that's not coming to my head right now, so forgive me.
That's great. Thank you so much.
Yeah.
Yes, thanks, Heather.
Okay.
Okay, we'll take the next question, please.
We'll take the last question now. Please go ahead. Your line's open.
Hello? Do we have a question here?
Please go ahead. Your line's open.
Hello? Can you hear me?
Oh,
thank you.
Yeah.
I have a question about hydration. Can I test for hydration? I had an issue with that, and I really don't want to, but I can't get any definitive information on staying hydrated.
Well, this is Heather. Well, can you test for hydration? We do. You can't personally test your body level. No, that's extremely difficult unless you're in some sort of a research setting. But for the most part, when you go into your physician's office, I don't know where you are in your scheme of things, but when you go into your physician's office, the clinic. So I work in a large clinic. Every patient that comes in, we assess to see how well hydrated they are by a number of reasons. We can do blood work. We can tell by your kidney function. We can tell by your urine concentration how well hydrated you are. We can tell just by your skin if it's really dry or scaly-ish, for lack of a better word. Scaly is not the right term. Dryness. We can tell by your lips if it's cracked, by your tongue. So we can tell a lot by that. We can tell sometimes that if inside your mouth seems to be very, very dry. And we know that certain medications will dry you more so than others. So some simple things, just try to always have something with you to drink. If you're carrying a nice, beautiful water bottle, or if you're home and you're sedentary and you're sitting around, always have a glass of something next to you. fluid comes from many different ways. It doesn't just have to be water, but you can flavored water. You can add a little bit of flavoring to it, a little quarter cup of cranberry juice, or a low sugar juice, natural juice, not something like a fruit punch or a soda or something like that. Tea is also perfectly fine. 1 or 2 cups of coffee. Coffee could be a dehydrator, but coffee, 1 or 2 cups of coffee is okay. Foods naturally have water as well. So watermelon, strawberries, and cantaloupe, the melons are loaded in fluid, loaded in water. So if you're having fruits and vegetables, as well as celery and tomato and cabbage and peppers, these are all, you may not realize it, but it's all naturally high in water. So if you're having an array of fruits and vegetables, you're also getting fluid.
Oh, great. Thank you.
This is David. I was disconnected, so I called back in. I don't know what I missed. But I do have one thing to say about fluid intake, if I may. Sometimes it's much easier to drink large amounts of water or consistently drink water when it's not ice cold. And I've found that lukewarm or even slightly warm water is much easier to take in. It also flushes your system. I was just reading about this, in fact, on an MD website. Flushes your system. It's better for your GI tract not to be drinking ice cold anything. That helps me too in bulk. Thanks.
I have to agree with you, David. A lot of patients do say they tolerate that better, slightly warm, even add in a little bit of fresh lemon or fresh lime to the water. Yeah, in the mornings it's usually, and it goes down nicely, and it's good for the GI tract.
Yeah.
Great. Good to know. Thank you. That's very helpful.
Thank you. I have a question for you, Heather. I'm curious, you were talking about proper washing that you do with patients. What do you recommend, especially with all these romaine concerns and things that you have, how we can really wash our fruits and vegetables good to get all that junk out of there? We simply, as part of our class that we teach and our printed information that we do have, we simply say plain water, plain tap water, and a vegetable brush, which you could buy in the grocery store, just to scrub the outside of the fruits and the vegetables. In reference to a salad, if you are using, the lettuce, like an iceberg lettuce, where you take it leaf by leaf, you put it in a bowl of cool water and let it swish around a little bit. And then the important thing is that you open the tap or the sprayer and you wash it again. You don't just let it sit in a water and swim around in case it's contaminated. So that's what we recommend. If you are right out of transplant, within, you're still immunocompromised or you're still susceptible to a lot of infection, I still won't recommend yet romaine. I know it has been lifted, but I still won't recommend, especially under what we're going through right now with the shutdown. If you're really, really immunocompromised. If you're far out, you may want to, it may be okay, depending on your response, but if not, then you may want to reconsider eating salad, especially on the outside. Also, a good tip is to add, if you're washing your berries or washing any fruits, just to add a capful of vinegar or a dilution of baking soda and water in a bowl, just to swish around the fruits and the vegetables, take some of the wax off of it, and then you can rinse with plain water and have it. Right.
Oh, one more thing. An avocado. I don't know how many of you love avocados. Rich in magnesium, rich in vitamin E. Magnesium, it's wonderful, but it's pretty dirty. So you have to wash the outside of the avocado really well.
Oh, that's good info. Okay, well, if there is one more question, I think we could probably take one more before we start our closing comments. Do we have any more in the queue?
We don't have any more at this time. I'm going to turn the call back over to you for any additional closing remarks.
Can I mention something about the turmeric, or do you want to talk that offline?
Oh, you know what? Go ahead. You share it.
I know David, you had mentioned the turmeric, right?
Yeah, turmeric in capsule form for peripheral neuropathy.
Right. So I am seeing that more and more, that patients are taking turmeric for pain. And if my whole thing when we recommend to our clients, our patients, is that if you're not on any therapy, you're not on chemotherapy or any of the anti-rejection meds, then it's perfectly fine. It's perfectly fine. You just do have to make sure that the supplement, the capsule or the supplement, is a very high percentage of curcumin.
Yes.
And that it's from a reputable company, someone that you trust.
Right.
So,
good. Thank you.
Yeah.
And how does someone decide a company is reputable? Are those listed on some of the websites you mentioned?
That's the $1 million question. That's the $1 million question. And that's why I hesitated, actually, when I was going to say.
We will make sure people do their research on who's reputable. But
right. Exactly.
Right now, first and foremost, I want to thank both of our speakers. There was such a wealth of information shared today, so I thank you both for taking the time to do this call. I also want to let everyone know that we will be typing up notes from the call and sending it out by email probably within about a week. And then next month, we have another Lunch and Learn called You and Your Valentine, and it will be helping you learn some tips on how to stay strong in a relationship and as a caregiver, how to help your partner get through this. As well as I want to let everyone know that we are going to be sending out a survey today. If there's anything we could have done differently to make it easier on this call, or if you have any ideas for future calls for us, we are certainly open to that. So thank you, everyone, for joining us today. If you would like any further information about our survivorship issues or supports available, please feel free to contact us at 1-800-LINK, which is LINK-BMT. Thank you, and have a great day.
Thank you. Bye-bye.